welcome to the Egyptian Neurosciences presentation. We're in public December 3rd, 2024. So we had our first year anniversary quite recently, and we're excited where we are. There's probably going to be a few forward-looking statements and so on that, and I'm a free talking guy, so transparent. So I want you to especially take a notice of this. So as I said, we're in public just over a year ago, and but we started over 10 years ago with a kind of tricky task. So a professor at the University of Miami called me up and said, "Chris, if we can make resveratrol highly bioavailable, we know that there's tons of different indications that it can be treating. If we can't, forget about it." I had some friends that in my earlier companies that were very good in formulations and so on, and we were the first company in the world, and still is, that have been able to take making resveratrol bioavailable into your bloodstream, which has been the culprit for many years. About 25,000 papers on resveratrol, very successful in mice, in metabolic diseases, CNS diseases, and other mitochondria area and so on. So that is really the basis of where we are. And so we did a phase 1 study that was backed by NIA and showed that we had 9 times higher bioavailability, which means that we get enough in the bloodstream, it passes the blood-brain barrier, and so on to make the magic in your body. That means that we can use that study for several different indications and so on. We now are in a phase 2A with Parkinson's disease, so that's our first target, and with top-line results expected by the end of this year. But you know, biotech, and I have started many different businesses, and I like cash flow. Biotech is absolutely not cash flow. It's either zero, or if you are lucky, then you can get a lot. Dealing with a natural compound, and then we got funding from the IPO. Our team decided, you know, then unanimously, let's go after this big longevity and aging market that really has accelerated the last couple of years. So we created the Nujivia product line, all based on, and every one of the 3 products that we have now also have our patented Jotrol resveratrol product included. So we have one product for your mind, one for your muscles, the mitochondria, and one that is beauty from within, which is glow with Jotrol combined with astaxanthin. And I haven't been invited to Jimmy Fallon, but when Martha Stewart introduced her skin line with astaxanthin, she was invited to talk there. So maybe I get an invitation someday. And of course, when you come into the DTC area, which we sell now, we just started to sell Nujivia direct to consumers. We have influencers, among others, Annika Sorenstam, the best female golfer ever, and Chris Webber is a basketball player, very well known for most in that industry and so on. And right now we have R&D, of course, approved and so on, but I'll talk about that later. When you look at the extension on the pharma side, so if you think about our company now, small biotech, but has one funnel here where we'll go with RX route, with Jotrol alone as a product. And then we have on the other side a wholly owned subsidiary that will then start to generate cash flow. With the Parkinson's trial, once we get data on there, we feel that we can get enough information to go into Parkinson's or Alzheimer's, the MCI area, Lewy body dementia, and so on. But of course, it's left to be seen. So when we talk about the Parkinson's trial, we got the IND granted in November. We expect to have the first patient screened next month, and also dosed then in March. And we expect to have more or less the the trial completed with inpatient stuff late this year, and top-line data hopefully before the end of this year. The reason why we're very confident about the timeline is that the group that we're working with in Parkinson's, they're all KOLs in the Parkinson's area. It's the MedStar organization around Georgetown, so all these members here of our clinical advisory board are also PIs. And they already have the patients, so it's their own patients. It's a mix of from mild to severe Parkinson's patients, and so it's all teed up. So we don't have like the regular problems with patients enrollments and recruitment and so on. These are already existing patients to them. So it's a placebo-controlled study, and then it's 2 doses, 200 milligram of resveratrol in the Jotrol formulation and 400 milligram. Total of about 12 weeks to be completed. So when you start to calculate that, we get the patients in quickly, and it's at 12 weeks. We should be able to get the data by the end of the year. Of course, as a regular phase 2, you always have safety and tolerability as the primary endpoint. But we are doing CSF. We're going to do brain scans. We're going to do fall rates. The KOLs believe that we can have some exciting numbers in reduction of falls. I'm not an expert in that side, so I can, but it will be fantastic if we can show that our product can just do something simple like reduces fall rates on elderly people. And we're going to do a lot of blood biomarkers, NRF2, NLRP3, TREM2s, and so on, to then use that to look at that, for example, for other clinical trial, other therapeutic areas, and so on. So we're very excited about that, but we focus on doing this trial alone until we have the results from that. So Nugivia, the direct-to-consumer supplements, is then we're very excited about it, and we actually just did a press release this morning about the GLP-1 area and so on, that we are one of the targets. And for some reason, we have had earlier about 66,000 shares traded, but we had close to 9 million shares traded so far today. Unfortunately, that meant that the stock didn't go up; it went down. But of course, as you know, that are familiar with trading and so on. These are not most likely not humans that sit there and trade this. So it's. But anyway, we're still excited about this. So Annika is a close friend of ours. She said, "Chris, I'm not going to do this without knowing that there's science behind it." So, and Chris Weber was the same. And we showed them. Gene Falacara is one of the world's top biohackers, very well known in that community. So we're anchored there as well. And we expect, we don't have direct sales forecasts. We just started, so we're tapping into the market, but we already know that there are several different channels that we can go. We've been approached by like compounding pharmacies, for example, that has a lot of customers that sells directly into physicians. A couple of people in our office have gone to the dermatologist, and dermatologist asked, "What have happened to your skin? Have you taken biosimilars?" And I said, "No, we just take Nugivia Glow." And then, so okay, can I sell that to my customers? So we're building that right now. It's a lot of fun. It's very exciting and so on. And then when we look at where's the low-hanging fruit, well, the regular resveratrol today, total market in the US is like over $100 million a year. So that's one area we said we're going to definitely target. Say we have the best resveratrol there is, and then why not, try this? And you don't, because if you can actually take the regular resveratrol and get these results, but you have to take about 5 grams a day, and I can guarantee you, once you start to go over 1.5 to 2 grams, you're going to sit on the toilet the whole day. So that's really the only side effect of resveratrol is this, because of the poor bioavailability, you have to take so much to get something in the bloodstream. And when you take a lot, then it has a severe GI side effects. So with our product, it's enough to take 500 milligrams and you get the full therapeutic effect. So you avoid the whole GI side effects. So that is, of course, number one. There's, when you look at Google research, Google searches, what is one of the most, things that people are asking about? A lot of people, especially 50 plus, asking how can I prevent not getting Alzheimer's, especially if they had Alzheimer's in the family. And like my mother passed away in Alzheimer's, and it's awful. And we all know that. Everyone has someone that they know about. So that is, of course, a target. But we also, since we see ourselves as FDA regulated, we want to be careful in how strong message we go out and so on, because we can't prove yet that we can maybe prevent Alzheimer's. One thing, very interesting thing is, was an article in the Aesthetic Surgeons Journal a few weeks ago, and that talked about Ozempic face. So that's a new terminology caused by the GLP-1s, and it was regarded as kind of like they don't call it the side effect, but it's more of an effect of the GLP-1s. When you lose a lot of weight and so on, you also lose a lot of your muscle strength, and in a couple of areas where you actually lose muscle and also look different. And they state that GLP-1 users that you lose quite a bit of weight, they also look 5 years older, from it. And so we ran, and I totally open, this is an AI-generated, study that we did with our, how could Nujivia products, avoid that for a GLP-1 user. And we ran 3 different sites. There's different, of course, the ChatGTP, but also then SciSpace and others that is more scientific-based AI. They all came back with the same results. A combination of Nujivia Mind plus Nujivia Power should alleviate that problem if people with GLP-1 takes this simultaneously. So we just made that announcement this morning, that this is now a new target for us within Nujivia, and this will probably be something that we'll look for distribution channels that into the wellness clinician state places and so on, and see if there's the big compounding pharmacies that are supplying all these physicians with GLP-1s, hopefully also take on our product. So that's it for now, and then please follow us, and if you want, we have 2 websites, the Jupiter Neurosciences plus the Nujivia.com. And so welcome with questions.